Hi, welcome to Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Wiening.
So today we have a short episode, well hopefully it'll end up being short, on whether or not my hardware has to come out. So why don't you set the stage there?
Yeah, so someone sent in a question saying, hey, I have some hardware from previous surgery, does it have to come out? So first, what do you mean by hardware? So typically when you have a broken bone, and you have surgery, it can be fixed with a metal plate or screws or pins or rods. And a lot of people ask, hey doc, I don't know, does this have to come out or does it stay in for the rest of my life?
Generally, the way the hardware is designed, it is there to serve its purpose temporarily. Okay, so if you have a broken bone, I'm just going to take a forearm, a radius for example. You broke your radius, someone went in and put a plate and screws on to hold the bone until it heals. If the bone doesn't heal, the hardware will break. It will fatigue and fail eventually. If that happens, yeah, you have to take your hardware out and probably have it revised so that you get a new plate to make that bone heal.
Right.
Once the bone heals, it takes the load, so the hardware no longer sees any forces or any load, so it doesn't break and it can stay the way it is forever. So generally, in a successful open reduction internal fixation, that's what it's called when we go in and put metal and screws to hold broken bones, it's called open reduction internal fixation. After a successful open reduction internal fixation, generally the rule, my rule anyways, is the hardware can stay in forever. However,
Totally agree. I have three main reasons where hardware should come out. And I never tell someone it has to come out unless hardware is coming through the skin, so I can see it.
take it out.
Not good. If it is going into a joint and causing that patient to get arthritis around where the fracture was,
Take it out.
and number three, if it's causing severe pain and both myself and the patient can be confident that it's the cause of the pain.
Right. So if it's
Take it out.
superficial, like around an ankle, and it hurts when you put on your hockey skate or your ski boot,
Very Canadian reference.
yeah, for example, then sure, then it might be reasonable to take the hardware out. However, why don't we like to take the hardware out all the time? Every time we put hardware in, bone's healed, let's get the hardware out.
So a practical reason in Canada is because it uses operative time that can be used for other purposes.
Okay.
And because it doesn't have to be taken out, but probably the other reason is because it has risk.
Yeah,
It's
that's
surgery.
the main reason. Why would you undergo surgery if you don't have to? Because every surgery has risks, especially when you're going to take hardware out, because the anatomy's been changed, so you might have a risk of nerve injury or vessel injury or muscle injury. So sure, if you don't need surgery, don't have it done.
I think that's wise. If I do take it out, other than those three things we talked about where it potentially could be more urgent, if it's only because it's painful, I usually try to make them wait 1 year. Paul, it seems a bit arbitrary, and I guess probably is, but that's kind of a ballpark number that I give them. I can be confident that the bone's totally healed, because the last thing I want to do is take the hardware out and then them go out and play rugby and then re-break their wrist because it wasn't healed yet.
Any of my patients watching, please ignore that, because I always tell them 2 years.
Okay. Okay.
And I just thought of another one, infection. If there's an infection going on, then the hardware has to come out at some point.
At some point. However, the timing of that could be delayed. Again, it's a very specific case-by-case decision where sometimes you want to wait for the bone to heal and then take it out, but I would agree in the setting of infection, if there's metal there, unfortunately the infection typically cannot be resolved if there's metal there.
Right, so you've got to take the hardware out.
Totally agree. Are there specific risks of surgery other than the ones we talked about, like nerve injury or stiffness?
Well, sure. It depends where the hardware is and how big the surgery is, but anytime someone has surgery, I always say there's always the risk of heart attack, stroke, death, blood clot, infection, pneumonia.
For sure. Are people always better after you take their hardware out? Oh.
No. Sometimes you take the hardware out because the patient and I thought that was the reason they were having pain, but turns out that wasn't. The hardware's out, you had surgery, and you still have some pain or discomfort. That can happen too.
Yeah, because you had an injury, because you have some scar tissue, maybe because you have some early arthritis, or maybe you have something else going on. So you want to be confident that the hardware is the cause, rather than just assuming, hey, I have a sore ankle and I had ankle surgery, the hardware must be my problem.
I promise this would be a short video. So,
okay.
If you have any other questions,
please email talkingwithdocs@gmail.com.
And remember, you are in charge of your own health.
See you next time.